Okay, welcome everybody. I'm Zoe in Beijing, CGTN anchor. As we understand, the global war against the coronavirus intensifies, and science and technology are obviously taking the lead in the fight. So, what are the latest developments? How exactly has technology helped to contain the outbreak? And what is the role of technology in public health? To talk about all those issues and more, today I'm honored to be joined in our live webcast by experts from China, Algeria, Portugal, Malaysia, and Norway. And viewers can also participate by leaving your questions or messages in the comment section of our social media account. The world is obviously struggling in their own way to cope with the coronavirus epidemic. As more and more countries are under lockdown, some people in China are returning to work. So let's first begin with Mr. Gu Fei. He's a senior algorithm engineer at Alibaba Group. He will talk about the life and work after coronavirus. Gu Fei?
Hello, everyone. Hello.
Hello.
So how your work at Alibaba will begin every day when the coronavirus is still looming large, still looming.
Yes, so I think at the beginning of this month, as the newly diagnosed patients number reduced a lot, and so we are planning to go back to work, and we set up some systems so we can work uh, safely. So first, we are required to stay at home for the isolation for 14 days. And after 14 days, we are eligible to go back to campus. And also we have set up some checkpoint. I will switch my camera. So here we have this temperature checkpoint, and as you can see, we have all those sanitizer and also the thermometers. So I will try to go into the campus after the temperature test. So everybody, the temperature below 37.3 Celsius is allowed to go enter into the campus. And after swipe my badge, I go into the campus, and as you can see, everybody here, cause it's we are still at work, so not too many people in the street, but you can see everybody wear the masks. Our company offers masks per day for every employees.
Mm.
So now I'm going to
You
my
are
working
going
space.
to your office, Mr. Gu, and keep us posted. What is it like going to work at this time of coronavirus? And then I'll introduce each and every panelist at this webcast broadcast. And please introduce yourself, and also what is it like in your country? How do the people there respond to the pandemic? Why don't we start with Dr. Hanafiah?
Hi, thank you so much for having me to be part of this panel discussion. So very happy to share our recent experience in Malaysia here. So we've just entered our second week of having a movement control order, and that's because we had a second wave of outbreaks here in Malaysia after there was a large gathering that had some international attendees as well, and now we've got some community spread, but I think the order has allowed us to actually track the progress of the outbreak and hopefully slow it down. And we're aiming to flatten that curve by ramping up testing as well. But we've also just found word, just heard word that the order is going to be increased for I think another week. So just trying to hang in there and keep our spirit.
So is everybody stay at home to work, or they can still go
So
to their offices?
So the government has outlined essential and non-essential services. So those who are deemed in non-essential services or those who can actually perform work from home are all required to work from home. And there are also police and military patrolling to ensure that as much compliance is achieved as possible. So grocery stores are still open. I just did my grocery run a couple of days ago, and so we have the people working at the supermarkets, of course, and of course our wonderful frontliners who's really, um, uh, I don't know, braving through this unprecedented epidemic. So obviously they're still working.
Are people cooperating and stay at home as much as possible, or still people on the street?
So I think there was some confusion in the beginning, but people are understand. Like there's been a lot of communication about why it's important and why this measure had to be taken. So there is more and more compliance. And if I look outside, I do see less cars every day. So I think people are getting used to this new way of life that we have to go through in order to battle this epidemic.
All right, let's go to our next panelist, Mr. Patterson, Director of Communications for Norwegian Institute of Bioeconomy Research. Mr. Patterson, right there.
Yes, hello from Oslo, Norway. Now we are in the second week of quite strict restrictions in Norway. So here it's every university, every school, kindergartens, they have closed, and people are urged to work from home. So as of today, I guess that at my workplace, for example, about 80% will be working from their home office, which is challenging, but so far it's working okay. And the society as such is still functioning, but the restriction of movement, for example, is there, and our borders. If you come from abroad, you have to go into a 14 days quarantine, for example, and there is also quite strict restrictions on movement inside the country.
And because those European countries, big European countries like Germany, France, and Italy, are facing a very severe problems of infections. What about Norway? Are there infection cases also going up? Is this still in the period of containment?
Yes, you can say so. We are still in an early phase, and because of the restrictions, we are trying now to flatten the curve, as we say. So we have a population of 5.5 million, and today we have maybe close to 2,500 infected that we know of. And we are working to flatten the curve and to give the health service the time to prepare for more infections. So far, that seems to have been working. And the government yesterday, they decided that the restrictions are to last for another 3 weeks at least. Sorry.
3 weeks at least.
Yes.
All right. Let's go to our next panelist, Professor Thomas Kraft, co-chair of the Commission on Environment and Health of the International Geographical Union. So, Mr. Kraft.
Yeah, good morning. As you mentioned before, I'm currently in Portugal, but actually I'm German and at a Dutch university. So I'm actually based in Maastricht University, at the Faculty of Health and Medicine. But I'm currently with my family for a sabbatical at the University of Coimbra. And due to the containment measures, we are not able to return. We are in a small village close to the sea near the city of Coimbra. Everything is very calm. Portugal has also enforced strict movement measures, control measures, and universities, kindergartens, schools are closed, similar to the situation in Norway. Portugal was really concerned because one country that is really struggling at the moment is Spain, the only land border that Portugal has. And so they're really concerned that it will also spill over. At the moment, we still see a rise of. We also need to keep in mind that containment measures always show results with a gap. So we're interesting to see how the containment measures that are really strictly enforced will turn out in a week's time or so. And what I can see as a guest in this country is that the Portuguese population is extremely understandable, very cautious, polite, and really strictly following the orders to stay at home and avoid unnecessary contacts.
Are the people in your area worried about the spread? Do they stock up on daily necessities?
Interestingly, no. There was no. They are really taking it serious, and they're also observing the contact containment measures. But for example, here in the village, there's one grocery store that told everyone from the beginning that they have sufficient supply, and people are not hoarding or without any reason. So I think in a way it's a normal life, besides the fact that we also have to stay at home.
Okay. It's normal life, at least for now. Let's move on to our next speaker, Mr. Mabarak Boukaba, the Honorary President of National Union of Algerian Technologists and Scientists. What is it like in Algeria? Mr. Boukaba? Well, it seems we don't have an audio for Mr. Boukaba. Now we understand Mr. Gufei is already at his desk in Alibaba. So you've been through all the temperature checks and
Yes.
walk into this. Can you tell us what kind of work do you do? I know you are algorithm developer, but how is it related to coronavirus diagnostic process?
Yeah, during this virus epidemic, we have developed a bunch of AI tools to help to diagnose from either the image or from the genome. So I will briefly introduce three of our tools.
Can you be a little bit closer to the microphone and louder?
Yes. So is it better now?
Just be a little bit closer to the microphone.
Okay, so yeah, so I will briefly introduce three of our tools, AI tools, used in this coronavirus epidemic. So it's okay now?
Yes.
Yes. So yeah. So for the first one is this, and I will broadcast a video and. First, we select a patient and on the diagnosis. So now the risk value is here, and it's almost 99.99%, and it's very high risk. And then we'll go to the CT images, and so we can select some of the slides of the CT images, and we can see that some of the regions that has been highlighted by the box, red box or blue box. It means those regions are related to the it's maybe affected by the virus, and so this is one of our technology. And the second one is the
So you are telling us that we're using a computer to read the CT scan of lungs. Is that the
correct? Correct.
How accurate and how effective is that in comparison with human reading?
Now the accuracy is around 97%, and it's very fast. It can be the report can be generated under 20 seconds. So usually it will take a doctor 15 minutes to get the report. So it's much faster and very accurate.
Go on,
The
Mr. Fu. The second one.
The second one is the whole genome sequencing system. So after we log in the system, we have a bunch of functions, and first is the sequencing analysis functions. And this is one report. We can get the numbers that are generated from the virus, the sequence numbers generated from the virus. And then we are required to generate the sequence itself for the sample, so that we can compare with the virus. So we generate a coverage and the length and the similarity of the sample, tested sample sequence, and by comparing with the real virus sequence, we can get the diagnostic report for the patients. And after that, we also interested in the structures. So first we select the parameters, and we upload the protein sequence from the virus, and we then generate the structure sequence for that particular sample. So both the sequence and the structures are very important in the analysis of the coronavirus. And
Mr. Gu, can you tell us why it occurred to you to develop an algorithm to read the genetic makeup of the virus, and by how much it increased the testing rate of the samples?
Is its genetic sequence. The coronavirus its genetic code is from RNA. So we need to first get the entire length of this RNA, so that we can make further analysis. For many viruses, we know that it may be varied a lot, but for this coronavirus, it also has some mutated point, and we know that. So we know that like for China, we have published a diagnostic instruction so that the whole genome sequencing, as well as the PCR and other antibody methods are used for the test tools.
Thank you, Mr. Gu. We have another panelist from Algeria on the line, Mr. Boukaba, Mr. Tarek Boukaba, the Honorary President of the National Union of Algerian Technologists and Scientists. Mr. Boukaba, can you hear me? What is it like in Algeria?
In Algeria now we have 264 cases and 19 deaths. And we think that the epidemic will still grow in the next days and weeks. All cases come from outside, especially from France and Italy. This is the situation now in Algeria. The government give instruction to people to stay at home, and we are staying at home. Only the important function for food and medicine and hospital are working 100%. All others are working less than 25%. So we are in the same situation like
in Algeria. All those cases are imported cases.
Yeah. All cases are imported in the beginning, but now is also some locals. contamination now can be also locals. But in the beginning, there is one case from Italy and 2 cases from France. And now we have 264 cases and 19 deaths. So the government give instruction, very strict instruction, to people to stay at home and to stop the infection, to stop the dissemination of the infection. We are waiting the few days, in few days and few weeks to see the result of this confinement. We hope that this confinement will give very quickly the good result. This is the situation now in Algeria.
So does Algeria worry about what will happen in Asia and Europe and now North America will happen in Africa, because that will be a big problem for a populous continent like Africa?
You know, this is the first time in the history of Algeria we know this kind of disease. So in the beginning, some people don't believe what happened, and they think that cannot be concerned by this disease. But after 2 weeks, now all people are worried to be sick, and now they respect the instruction of government. And you know, most country in the world, except China maybe, are not prepared to this kind of disease. We can see in Europe, we can see USA, they are not prepared. So the African country, and in this situation, I want to be the advocate of Africa and development countries. The situation can be bad because no any country has to this kind of disease, the pandemic disease. So we expect that to use the experience of others, especially the experience of the China experience is unique in the world. We see in all people can follow what happened in China and how the China people and China government take the situation to control it, and how they build a hospital in just few days, and the thousands and thousands of nurses and doctors, and very big logistic put. So for African developing country, we cannot have this logistic and capacity of organization, and we think the situation is not very easy for African country. You know, in Africa, many people don't have water. They don't have electricity. How to ask them to be clean? How to for hygienic? They don't have water. Hygienic is not very easy to do in Africa. So the problem is in developing country and developed country is not the same.
Yeah, exactly. That's why we should worry about the further spread of the disease. I promised in the beginning we will answer questions from viewers and social media users. I have this question from Claire Frompt. She said, how should I deal with the anxiety about the coronavirus? I feel very much stressed. I probably want each and every one of you to give your take on how should I deal with the anxiety. Let me start with Mr. Gu. China obviously had been undergoing that period that's the most stressful. And what do you say to those people who worry so much? Yes, Mr. Gu? Okay, seems we've lost Mr. Gu there. And then Dr. Ann Afiyah, what is your take?
I mean, I think if we look throughout history, epidemics, pandemics, viruses have come and gone. And if we think about the predecessor to the virus that causes COVID-19, the SARS coronavirus 2, that caused an epidemic, and then it now is no longer a concern of ours. And so there are a few scenarios. I mean, I think what's really positive is that for the first time, the whole world is really united in trying to address this virus and finding ways that we can contribute towards reducing the rate of the spread so that we don't overburden our healthcare system. And that's as simple as everybody just trying to stay at home, trying to work from home, learning from home when they're not going to school. And I think if you can channel your anxiety to doing something productive, and then I think you will find this period will pass eventually. There will be an end to the epidemic because this is a very standard thing that happens with epidemics. It will end. The question is, after this, will this become like a seasonal flu where it'll be just around and we just need to manage it? And if we buy ourselves enough time, we'll probably get a vaccine because there's already a lot of good work, a lot of positive developments on that front. We're getting diagnostics faster than ever, and we just need to test them to see if they work. And I think really the positive thing is so many people are working on this that we will get through it, I think. And there will be some really important lessons for us.
Important point. And Mr. Patterson, people not only are about the uncertainty of the response to the virus, but also their lives and their livelihoods, and whether they will lose jobs, what is in store for them. What is your thinking on that?
Yeah, this is a huge challenge, and it depends very much on the country, where you are, what are the baseline. And I think that we in Norway, we are in a better situation than many others. We have a pension fund, as we call it. So there are savings from the state that can be used in times like this. So for the time being, it's a lot of people that are out of work, but they're not out of means to live for. So they will be taken care of in the short term. In the long term, a lot of things will happen as a function of this crisis. I think society will change. So, but to your question about being worried, I think that public science literacy is crucial in times like this. You need people to understand what is happening and to have a basic understanding of science, of how this works, and some trustworthy sources where they can find this kind of information. So that is, I think this is a medical crisis, but it's also a huge communication challenge. Because if people are not given the right, call it information, we will have a huge problem. And there are a lot of misinformation also in a developed country like Norway. So I think that is part of it, communication and also the medical part of it.
And another question from our viewers, he asked, Huang Dao, he asked, how close are we to a vaccine? Will it be safe if it is developed in a hurry? So let me talk to Professor Croft. Earlier, Dr. Ann Afiyah also mentioned probably it will take some time to have vaccine, but how close are we? And is it safe to use a new vaccine when we're still fighting this virus?
I think we can trust that the laboratories developing this will test in the careful procedures that are necessary for doing this. So we have two developments at the moment. We have some tests of medication that can help to treat patients that are already infected, and we have seen some reports during the last few days that there is progress, and WHO has also started larger clinical trials and better coordination for providing these medical treatment. For the vaccination, I'm afraid it will take more time because we need to be safe and clear about it. And I would like to echo what my colleague from Norway said, the most important issue is really to be clearly transparent and open and provide necessary information and avoid that there's conspiracy theories and other debates that just confuse people. So I think the more transparent and clear we are about this, the better it is for the entire public debate. And also this reassure the population, even in a very critical situation.
And Dr. Mr. Patterson just mentioned science literacy, because people need to be better informed about what exactly is this virus, how should we look at it. What do you think are the most prevalent misconceptions about this virus and how we are dealing with it?
Well, I think, let me just refer to the public debate we had in the UK on herd immunity versus containment. I think the British government has also confused their own population by changing their policy 180 degrees just within a few days. And I think this is really not the right way of communicating if you really want to clearly have an understanding with the population. If you have these mixed signals, this is really creating a lot of misunderstanding and problems.
But why do you think the UK had bungled the public messaging war? Because it seems it is common sense that herd immunity would cost too much for any nation.
Well, now you ask me to speculate, and it's more a political answer. But what we need to understand is that the National Health Service is already at its limits. It's operating at the limits. And so I think there was just the hope that by going for herd immunity, they would be able to overcome the crisis. But just based on the report that was published by my colleagues from it was clear that this is not going to happen. And this is not going to be the appropriate strategy. So they had to change their strategy again. But I think it is a reflection of the limited resources that are available in the public health system at the moment.
Yes. And Mr. Bukaba, this third question from the internet users, Vincenzo Perrotta, that question actually we touched upon a little bit earlier. He asked, even those developed countries can't stop the virus, how can the developing cope with that? Their health system are poorer. Is that going to be a huge humanitarian crisis ahead? I think this is a legit concern. How should those developing countries, especially those with not so robust healthcare system, deal with the worst scenario if it is the case, God forbid?
I think that the worst scenario is a developing country is that nearly 60% of population will be infected. And the immunity can be, have this immunity. But unfortunately, many people with other disease will die. This is the problem. But I see that in many developing countries, the government have a good action to stop the spread of this epidemic by asking people to stay at home, don't go outside. This is the best thing to do, because hospital logistics for health hospital is not enough. So the best thing to do is to stay at home and to isolate the virus and the spreading of the virus by staying at home. This is the only what we can do in this country. We also waiting with a good hope if any medicine can be put on the market. Now there is some medicine like chloroquine. Chloroquine now is very, many people speak about chloroquine, and the situation is not clear for chloroquine, but many specialists, many very good doctors say that this can help very quickly the people, especially in Africa. In Africa, chloroquine is very popular because chloroquine is for malaria. And many people in Africa take chloroquine normally from many years. Maybe for this, they don't have so much infected. Maybe, I'm not sure. I already say this. So we have a great hope about this new medicine, because for vaccine need time, need at least for a developing country, at least 5 years to
5 years. Some say
yeah,
18 months.
No. I mean to cover. If the scientists discover today a good vaccine, and for which virus, the virus can mute, can change every time, and we need to use this vaccine with very carefully. But the chloroquine, I think now is a good hope for.
Americans also talking about the efficacy of chloroquine. I have a little doubt about the spread of the disease in Europe and also North America. So, Mr. Patterson, a lot of people here in China a little confused why the Europeans couldn't learn from what happened in China, because obviously this is a repeat of something that happened in Wuhan, because Wuhan did successfully isolate, test, and quarantine, and then the infection number dropped. Europe saw it all. Why couldn't Europe handle it by learning what happened in Wuhan?
I think there are different answers to that, because one answer is that it would be very difficult in a lot of European countries to impose those kinds of restrictions on the population. Politically, very, I think, unlikely to do anything like that.
But they're still doing it. France, Italy, and Germany also still doing it.
Yeah, because they were forced to after a while. Then they saw it coming like a flood wave. But I think it's different strategies in different European countries. Some took this very serious from the beginning, and some didn't. And like in Italy, I don't think they realized that they had the infection in the population. It took some time before they realized that they really had this huge problem. So the epidemic got a head start. So they weren't taking the science seriously enough, we could say, in retrospective. But then you have different strategies, like some of the Scandinavian countries. They have been waiting for the first infections, and then they impose restrictions, not before. And then they get this support from the population, and they are now tightening the restrictions with support of the population as the epidemic unfolds in their country. But they are flattening the curve. It's not so many infected, not so many people hospitalized. So that is a different strategy, I think, than, for example, what Great Britain started with.
And Dr. Ann Afiyah, obviously a lot of Asian countries are also facing difficult choices now. India is having a national lockdown. Malaysia is doing the similar thing, in Indonesia. How do you think these countries should look at the scope and dimension of this problem, and are they doing enough?
I think a lot of people are sort of trying to hit the ground running now, because you only know once it's hit you how bad it can get. But I think the positive thing is, at least I can say for Malaysia, we have now announced that we're going to ramp up our testing. So that strategy was adopted by South Korea, where they really intensified their contact tracing and aggressively doing the tests. Because obviously, once you detect more people, you're able to isolate and then slow down the spread from otherwise people who you don't know have the disease. And I think as we move further on, the tests that we're using right now are these molecular tests that detect the viral RNA, and they require samples that are quite difficult to get. The tests themselves are quite expensive. That's going to be a limitation, as well as the fact that they do take at least a day to run. So what we're hoping in the technology front is that there could be better, simpler tests that can at least screen people before they get confirmed. So that can actually help ramp up the testing as well. And that's the area that I work in. So we try to develop these simple tests that you can use to diagnose an infectious disease in a drop of blood. And we've used this approach for some other diseases, specifically viral hepatitis, with the lab that I work with in Melbourne at Burnett Institute. But our challenge right now in trying to develop something similar for COVID-19 is that it's quite an acute disease. So people don't make antibodies soon enough for us to actually detect them meaningfully. So we need to find probably a different strategy or another biomarker in order to use this simple platform that otherwise have changed a lot of the containment strategies for other diseases.
I think this is also the problem faced by the Americans, how to make testing as quick, as effective as possible.
And cheap.
And also accessible. Why can't America, the number one economy in the world, deal with this problem effectively, as a lot of people expected them to do?
That's a very difficult thing for me to comment. I think I think one thing, the US is such a big country. You've got a lot of power in the individual states, and where you might not see some of the leadership on federal level, you actually do have a lot of states taking the initiative to having a target number of testing done, to have the social distancing order even before some other countries have announced it. So I think it's kind of unfair to say they're not able to do it, but I think maybe it's not as concerted enough from a federal level. Yeah.
And Mr. Gu, I know that Alibaba has been trying to use your strength in AI and big data to drive forward the development of vaccines and the diagnostic protocols. Can you tell us how widespread AI has been used in the response to this coronavirus, Mr. Gu?
Yes, so our AI tools have been deployed in many hospitals and CDCs all over China, and so now I think more than 150 hospitals have used our
150
CT,
hospitals nationwide?
Yes, use our CT diagnostic tools, and also we have hospitals in Wuhan and the CDC in Zhejiang. They use whole genome sequencing tools.
It seems this is the perfect time to use more of these technology to deal with a public health crisis, because obviously medical staff can also be infected with the virus. We need to keep distance. So, Mr. Patterson, do you think, seeing what happened with the coronavirus, AI and robotics will be used more in the healthcare sector in the future?
What we see now, I think, will change society forever in a lot of different fields concerning taking or using new technology. We see it, people are working from home, new technologies are being developed parallel in many countries in the world today to develop vaccines. And of course, they are using new technologies like AI and other. So I think this is, I had a colleague here one day that said that he thinks that this will jumpstart or make us jump 10 years in time in digitalization in our country. So that is how huge this change will be,
Because
in my opinion.
to adapt to the new situation.
Sorry.
because of the incentive to adapt to this new situation of a pandemic.
Yes, because everything is now put into to battle the epidemic, and it's also it's a lot of resources being poured in. A lot of scientific heads are sitting together working on this issue, and also a lot of private companies, computer companies. Everyone is working together to get this happening, and that is a very good thing, I think, in spite of this being a huge problem for many people and a pandemic.
And Mr. Kraft, what are you thinking about how this will change how we work, how we think, how we carry on our lives in the future?
Well, definitely with the experience that millions are now working from home, this will change our working style and working methods and the collaboration. But I would also like to add some thoughts about AI and detection measures. I think it is obvious that we lost time by late detection in a couple of countries. And so I also could foresee that we will have a new discussion about syndromic surveillance and comprehensive syndromic surveillance that will allow us to get earlier signals for outbreaks and unexpected situations. And here again, artificial intelligence will play a major role in helping us to support to identify early signals from comprehensive syndromic surveillance. And then there's another issue that I just, the other day I read a very interesting report from my colleagues from the Chinese Academy of Science, the Institute of Geographic Sciences and Natural Resources Research. They have done a study on GIS, Geographic Information Systems, and big data as a support tool for managing the outbreak. And I think this is also, we will see a revolution in these technologies because they really help for containment and for controlling the situation.
We are almost running out of time. Before I wrap up, I'd like each and every one of you to use one sentence to say what is the biggest lesson we learned from this coronavirus outbreak. Mr. Gu?
Yeah, I think we need to emphasize on every disease at the very beginning of the stage. And after that, the government should work efficiently to calm down people and to get the patient to be in the hospital as soon as possible, and other people who don't have the disease should calm down and stay at home.
Okay, your voice is a little low. I get that the government should respond faster. Dr. Ann Afiyah?
Well, I mean, this is basically our first big pandemic in the age of social media, where we've been complaining, this is the modern age, people don't interact enough. And now we're actually forced to only interact largely through social media, through technology. And it's been, I think, a very reflective period where, I personally thought about what I actually need to live and what I don't need, how much space is it actually that I require. And also just how I think about science in general, and actually how the science community is shifting their priorities to meet this common enemy. It was actually World TB Day yesterday on the 24th of March, but the address that the executive director gave was about battling COVID-19, because this is our challenge as a global community. And that's very rare. Most experts will just talk about their disease of interest. So I think it's a good lesson in our humanity.
Yeah. Mr. Patterson?
Yes, I mentioned earlier, I think that science literacy is crucial. It's also a kind of a vaccine. If we have a people that is science literate all the way to the decision makers, that will make us more
Probably
able,
especially politicians.
Yes, and to see what is coming and to prepare for the unthinkable. I think that is an important lesson.
Yeah. Professor Kraft?
I think the lesson is that we need to strengthen public health systems across the globe in the time where we have money and time to do this, so that we are prepared. And we need to understand that we are all in this, and that we have to show solidarity and support also to those that have less resources. So more international collaboration instead of national perspectives.
Yes, indeed. And Mr. Bukaba?
Yes, this disease demonstrates clearly that the world is a small village. And we also see that the United Nations organization is not efficient to coordinate the action in the world. The Organization of Health in the world also is not very efficient. So I think after this corona is not like before this corona, and the world need to be restructured, a new structure, a new international structure for better cooperation.
Yeah.
As you know that AI and artificial intelligence need that all countries join their information to have the very, very big data to find the solution in very short time. So what I think is what we need to change the rules in the international relationship, and to be more fair and less war, more development and less war.
Yes. Well, yes, indeed. Before this virus, we thought we were the smartest and most capable species in the world. But this is definitely a humbling experience for all of us. We must work harder in face of the invasion of a virus. Thank you very much, my dear panelists. Thank you for your wonderful insights. And that will wrap up this webcast of our debate on the global response to COVID-19. Thank you so much.
Thank you.
Thank you.
Thank
Thank
you.
you.
Goodbye.
Bye-bye.
Bye.
Bye.